Did you know that nearly 1 in 3 Americans will face a cancer diagnosis in their lifetime? It's a startling statistic that leaves most of us feeling uneasy, but the more unsettling truth is this. Many of these cancers are found too late, when options are few and outcomes are grim. Imagine this. Millions of people every year get diagnosed only after their bodies are screaming for help. But what if your body was whispering, weeks or even months before that? What if the earliest signs were so subtle they almost seemed harmless until they weren't? According to the American Cancer Society, detecting cancer at stage 1 can offer a survival rate above 90% for many common cancers. But if it slips through the cracks and reaches stage 4, that number can plunge below 20%. The tragic part: most people never even realize what's happening until it's far too late. That's why this isn't just another health video. It's a wake-up call, especially for our senior community. You deserve to know what's happening in your own body. So today, we're going to talk about 8 subtle but serious signs that could help catch cancer early, before it spreads, before it takes hold, and while there's still time to act. Now, I know what might be crossing your mind. Every ache and pain can't be cancer, right? And you're absolutely right to question that. But this video isn't about alarmism or fear-mongering. It's about sharing real, scientifically supported red flags, real signals your body may send when something is wrong. Because the truth is, many survivors owe their second chance at life to recognizing these very signs. You're about to learn what they are. Let's start with something that many seniors may chalk up to age: bone pain. Now, it's normal to have occasional soreness in the joints or back. But cancer-related bone pain is different. It doesn't go away after a good night's rest or after taking it easy. Instead, it intensifies over time. And often, it's at its worst at night, when everything else is quiet. This deep, dull ache doesn't respond to typical over-the-counter pain medications. It might start off as a mild throb, perhaps mistaken for arthritis or a minor sprain. But soon, it's keeping you up at night, making it harder to move, harder to walk, harder to live your normal life. For some people, the pain becomes so severe that even minor movements feel unbearable. If this pain is accompanied by unexplained swelling, increased tenderness, or, worse yet, a fracture with no clear cause, it's time to see your doctor. Catching bone cancer early makes a world of difference, and ignoring this sign is something you simply can't afford. Then there's the matter of your eyes. We don't often think of our vision as a window into potential cancer, but your eyes can actually reveal a lot more than you think. Ocular melanoma, though rare, is the most common eye cancer in older adults. It can begin with subtle changes that are easy to overlook, like blurry vision that persists despite new glasses, or flashes of light that don't seem related to migraines or eye strain. Sometimes a dark spot may appear on the iris, slowly changing size or shape. If you have light-colored eyes or fair skin, your risk increases even more. Most seniors get their eyes checked for cataracts or glaucoma, but these deeper issues can slip through unless your doctor is actively looking for them. Regular eye exams with imaging can be life-saving. If you've had persistent eye pain, pressure behind the eye, or any new, strange changes to your vision, don't delay. Early treatment may protect not only your vision, but your life. Skin, too, has a way of telling us things. You may have noticed tiny, reddish-purple spots on your skin, maybe around your ankles or under tight clothing like your waistband. These spots, called petechiae, don't blanch or disappear when you press on them. Many people dismiss them as minor irritation, bug bites, or even a rash from aging skin. But what they actually could indicate is something far more serious: leukemia. This type of blood cancer disrupts your body's ability to produce platelets, and without them, tiny blood vessels leak and create these pinpoint hemorrhages. If they're accompanied by easy bruising, unexplained bleeding, or a feeling of fatigue that just won't lift, don't brush it off. These little marks are your body waving a red flag. Most people ignore them until it's too late. Your fingernails also hold secrets. Have you ever noticed a dark vertical line under your nail, especially on your thumb or big toe? This could be subungual melanoma, a dangerous form of skin cancer that develops beneath the nail. At first glance, it might look like a bruise from bumping your hand or foot. But there are differences. A cancerous streak often appears suddenly, grows in width, and sometimes has multiple colors or blurred edges. If the dark pigment spills out onto the surrounding skin, known as Hutchinson's sign, that's an especially concerning clue. People often mistake this for a nail fungus or trauma and let it go untreated. But this form of melanoma can spread quickly. Don't wait until your nail splits or begins to bleed. If you see changes and can't explain them, get it checked. Let's talk about a symptom you might not associate with cancer at all: night sweats. We all sweat sometimes during sleep, especially if it's warm or we're bundled up. But persistent, drenching night sweats that soak through your pajamas and bedding, especially when they're not explained by menopause or room temperature, could be something much more serious. Lymphoma, a cancer of the lymphatic system, often presents this way. It may also come with unexplained weight loss, fevers, and fatigue. The immune system's battle against the disease releases inflammatory chemicals that mess with your body's thermostat. Your body essentially believes it's under attack, even if you're just lying in bed. This isn't about sweating now and then. This is about repeated, unprovoked episodes that leave you drenched. If it's happening regularly, please don't ignore it. Another symptom that many seniors shrug off is chronic heartburn. We've all had indigestion from time to time. But if you've been experiencing persistent acid reflux, especially if it continues even after making dietary changes or taking antacids, there could be a deeper issue at play. Esophageal cancer can begin this way. It starts with recurring exposure to stomach acid, which damages the esophageal lining. Over time, this can cause a precancerous condition called Barrett's esophagus, which significantly raises your cancer risk. Now, imagine looking in the mirror one morning and noticing your skin and eyes have a yellowish tint. You might think it's just the lighting, or maybe something you ate. But that yellow hue is called jaundice, and it can be one of the most telling signs of pancreatic or liver cancer. These organs help process and remove bilirubin from your system. When a tumor blocks the bile duct, bilirubin builds up, turning your skin yellow and your urine dark. This is often accompanied by pale-colored stools and discomfort in the upper abdomen. The pancreas sits deep in the body, making tumors hard to detect early. But if you notice yellowing of the skin or eyes, especially combined with digestive discomfort, it's a sign that shouldn't be ignored. Lastly, we need to talk about fevers. You may not think much of a mild fever here or there. After all, they usually mean your body is fighting off a cold or infection. But when a fever keeps coming back, or lingers for weeks with no obvious cause, it could be your body signaling something deeper. Blood cancers like leukemia and lymphoma often lead to cyclical fevers, where your temperature spikes at regular intervals without an infection present. These fevers might be low-grade but persistent, and they're often paired with other symptoms like night sweats or fatigue. The body releases special immune chemicals in response to the abnormal cells, and those chemical messengers cause the fever. If you've had a fever lasting more than 2 weeks, or one that keeps coming back without an explanation, it's time to see a doctor. Look, not every symptom means cancer. But every symptom deserves attention. Your body speaks to you, sometimes quietly, sometimes urgently. And as we age, the need to listen becomes even more vital. These 8 warning signs aren't about living in fear. They're about living wisely, about staying one step ahead. So if something feels off, don't wait for it to scream. Catch it while it whispers. If this video helped you, please give it a thumbs up and share it with someone who might benefit. You never know whose life you might change. And if you're interested in more senior-focused health tips that could protect your well-being and extend your vitality, hit that subscribe button now. We've got more life-saving insights.